Sheriff's Office. We have our Sheriff, Dallas Baldwin, and his staff, Dave Masterson. Welcome, and you're on.
Thank you. I'm Sheriff Baldwin, and I'm going to turn the microphone over to Dave Masterson at this time. And everybody knows he's our HR budget person, so I'll let him start off.
All right, good morning. Thank you. So I'm sticking with the, parameters of the budget presentation. I'm here to present some of the accomplishments for 18 and goals for 2019 for some of our divisions under the Sheriff's Office. We'll go ahead and start with corrections. So some of the accomplishments for 2018, we've implemented search teams in both of our jail facilities. This was to reduce contraband coming inside the facilities and to maintain cleanliness and a safe environment for staff and inmates. Those have been successful throughout the year in finding some of the contraband items that inmates typically hide in various places. Next, we implemented a body scanner at CC2 that was purchased either late last year or early this year. It also is there to help reduce contraband. The process is done at intake as well as before transportation between facilities, and it's also conducted on inmates upon their return to the facility after they go to court or things of that nature. Next, our transition team was established late summer, I believe. It's a 5-member team. The responsibility of the transition team is going to be to develop policy and procedures and training for the new facility. It's going to also review current practices and operations to hopefully incorporate some of those in the new facility and, as mentioned, develop new policy. Next, we implemented a veterans dorm at CC2. The dorm will focus on veteran needs and programming and resources available for their specific needs. And also, one of the things that's in there, it reflects flags from the different armed forces to help those veterans that are unfortunately incarcerated reflect on their service with the country. Next, our social service programs. We've implemented several social service programs this year, and I'll list a few of those. We have the alcohol and other drug release prevention, cognitive behavioral therapy. This is a women's class that's to aid in the reduction of drug and other substance abuse and relapse. We've implemented a yoga class for women that's therapeutic as an extension to help with the alcohol and other drug addictions as a therapy and as a way to help transition them away from those particular dependencies. We have a sexually transmitted infection presentation and testing for women. It's offered by the Columbus Health Department and consists of education on STIs and other infections related to sexually transmitted infections. We have a Pathways peer group for women to help make better life choices or life skill choices to eliminate the dependence on drug and alcohol. We have a Peace, Love, Men's LGBTQ class. It's therapeutic art class created for a safe environment and an expression of art or through art. We have an infant mortality class for men and women. It's discussion on how infant mortality rates in Franklin County has reached a crisis level, and also to teach inmates how to prevent infant mortality. We've discussed the veterans dorms. Next, we will touch on our jail management system. That was a multi-year project that finally came to fruition. It went live in January of 2018. Advantages of the new system: it helps maintain better statistics, reduces paper use, and provides more detailed information for various inmate programs and anything else related to the inmates and their incarceration. Stumbled there a little bit. Next, we have detoxification, mental health, and elderly dorms. These dorms will help our medical provider and current staff to address their specific needs. We've instituted a hepatitis A and B vaccine clinic. This is due to the increase in the community of hepatitis A and B. We've taken preventative measures to continue to provide vaccine to inmates and staff on a monthly basis. Vivitrol and the MAT program. These programs are implemented to assist those with Vivitrol to control substance abuse prior to release. Medication-assisted treatment program provides resources to assist inmates upon their release as well. We've implemented in-house dialysis at CC1. That was a process that took some time once our transition over to NAFCare last summer, but it is at our downtown facility, and once again we received our National Commission on Correctional Healthcare accreditation for 2018. Moving on to goals, 2019 goals. Now these are a couple of the things that we hope to implement for next year. One of them is a corrections K-9 unit. We hope to develop a K-9 unit focused for corrections only. The purchase of those dogs, the plan is to buy those out of asset forfeiture. Its mission is to eradicate possession of contraband within our correctional facilities. It'll be combined with the search team's efforts to further remove contraband. We hope to begin direct supervision training at CC2. This will help create, our goal is to create a direct supervision dorm setting at CC2 to conduct training for staff in preparation for the new facility. We're working closely with Assistant Administrator Long to help develop that dorm. We're also going to create an honors dorm, which the primary focus will be placed on inmate behavior to help improve inmate behavior. Those that conform to these behavior type things that we're going to try and implement, they will have increased amenities such as microwaves, additional commissary items to be purchased, and things like that. We also hope to implement a pathways program for men, similar to the current one that's being done with women. We have, in 2019, some of our staff members, along with Franklin County Justice Policy and Programs, will event a one-day workshop on the Stepping Up initiative. It's hopefully will be presented to correctional facilities nationwide. Social service programs for 2019 that we hope to expand upon, similar to some of the ones we've gotten in 2018. We're going to create a yoga class for men. Ohio Means Jobs program, which is a workforce type program offered by Job and Family Services to aid those incarcerated with creating resumes and job searches. And we hope to get connected, start a Get Connected, which is a mental health program to teach inmates about mental health services, why mental and physical health is important, and how to set goals. And finally, the MAT coordinator. This is medication-assisted treatment. We hope to implement a MAT coordinator, which is a position that we're going to fund through a JAG grant to help address mental health within our facilities and coordinate resources needed upon the inmates released. So those are our accomplishments and goals for corrections. Do you have any questions before I would move on to our next section?
So as we're looking to do more with medically assisted treatment, with that grant, it's great you can start this position. Do you have a way to fund it longer term than the grant?
We haven't discussed that yet. This was a discussion we've had with Melissa Pearson, with the Justice Programs Group. Next year, hopefully or soon, will be a kind of kick it off. We have not discussed any further about future funding. Currently, no, we don't have any resources available that we could dedicate to that, so that would be a discussion that we would, come forward with at a later date.
Well, we've had these discussions ongoing for some time. We noticed, I noticed anyway, we noticed that there's as, that in corrections, you've got plans, you're heading towards the new facility with the plans that you've got, in place now. And so my assumption is that, that as you're building your corrections goals for the future, you're building them in with the new facility in mind.
Correct.
And so I guess my assumption is that you're gonna have conversations with amongst your staff and our staff about how we're gonna figure out how to move, some of these costs going forward with the expansion of the new jail.
Commissioners, Kenneth Wilson, County Administrator. A medically assistant treatment coordinator is a very important position in the community. Given the challenges we face, the only way we can really mitigate and stem this tide is with an expansion of medically assisted treatment.
Well, I
So
agree.
as the grant, if we reach a point where the grant would expire, I would be working with the Office of Justice Programs to see if there can be a reallocation of dollars from another area. Secondarily, I would also be in discussions with other partners such as Adam H. to see how we can in fact put resources in. The Stepping Up initiative is very important and key for us, but there are going to be instances where initially they're going to be in the front door of our facilities, and this medically assisted treatment is a pathway out, because without that, people just aren't successful in getting past substance use disorders
Or mental health.
or the
And I
behavioral
think
health.
both, for both reasons, was the reason I asked the question, because the stability of a person to manage that medically assisted treatment is gonna be critically important as we go forward.
Right.
So I would hate to see it grant funded and then the grant goes away and there's.
Right. There's a lot of optimism. Commissioner, there's a lot of reason to have optimism when you consider the success rate under medically assisted treatment is 97%.
Absolutely.
So in order to, it's a very cost effective to have more of these programs in place.
We, if I might add, we know that capturing somebody, that segment of inmates that come in and they need treatment from beginning to end. And we know the importance of that. So getting this coordinator's position right away to help move that for the new jail is vitally important. And we've discussed some of the current programs we've got grant funded and how successful they are, how important they are now in the big scheme of things. And we're looking at maybe reallocating some of that funding if possible to help offset the cost.
Good to know that you're looking at it.
Yes.
Okay, so we'll move on to patrol, talk about their 2018 accomplishments and 2019 goals. So we've installed over 70 WatchGuard, which are the in-car video systems, units in most patrol vehicles, as well as several other division vehicles within the Sheriff's Office. This not only upgraded the in-car video component, but it also allows for better evidence management of the videos. So that's been a very important project that we've, in conjunction with fleet management, we were able to get completed this year. We recently opened the Clinton Township substation, increasing Zone 2 response times. Weight enforcement deputies have currently taken 7.6 million pounds of overweight vehicles off the roadway and are still working closely with the Franklin County Engineer's Office to improve our roadways through strict enforcement efforts. As many of you probably know, we've entered into an access agreement with the A&E Show Live PD, which has already improved our social media outreach and transparency with those we serve. We hope that it will have some impact on our recruitment in 2019. We've created a peer support group for deputies that have been involved in critical incidents. This team is known as the Deputy Support Team and has been used 8 times this year. Let's see. Next is the Naloxone usage has increased and more patrol deputies have been trained to carry it. Our patrol narcotics team, want to give you a little information on that. In the last 5 months, the patrol narcotics deputies have made over 30 felony drug arrests and helped process the same amount from other deputies. They've made around twice that amount of arrests and misdemeanor drug charges, including drug abuse instruments and paraphernalia. We're waiting on approximately 25 lab reports for felonies and have 5 that will be sent to the prosecutors for grand jury soon. In addition, the patrol narcotics team has gotten 14 illegal firearms off the street, captured a shooting suspect for the city of Columbus, and taken several pounds of meth and heroin off the streets. And finally, one of the accomplishments for patrol is the CIT training. This year we've been able to, we've been able to send 50 to 60 additional patrol deputies to CIT training. This training falls within the guidelines implemented by Sheriff Baldwin last year when he took office. Having CIT trained deputies deployed across all 3 shifts, we believe, is saving lives across Franklin County. For 2019 in patrol, we want to continue to strive to reach our goal of adding more CIT trained deputies to all shifts. We're looking to provide PIT training, which is pursuit, intervention, technique, and certification to deputies on all 3 shifts. We look to address quality of life type crimes with targeted enforcement efforts, working with our Support Services Bureau. Those crimes include prostitution, low-level drug within neighborhoods, and also day-to-day nuisances. We're hoping to decrease the amount of accidents involving impaired drivers through continued stepped-up OVI enforcement through our grants. We also look to have our FTO coordinators provide a small-scaled, simple and active shooter response training sessions for on-duty deputies so that if there should be one, they would be able to respond appropriately. And finally, we look to deploy our bike unit into specific areas in the spring and summer for better enhancement of our community policing initiatives, along with coming up with innovative ways to interact with those we serve, but still maintaining a balance of enforcement efforts and community policing. So with that, that concludes patrol. Was there any questions that you may have before we move on?
If I could add just one comment, Dave mentioned the patrol narcotics team, and a little clarification on that. Currently, and these are not the minor possessions, I might add. Currently, when patrol comes across somebody with a fairly significant amount of narcotics, our SIU unit would have to come out and handle that initially. This relieves SIU of that burden. They're pretty well strapped anyway. So patrol handles that initial seizure, turning the drugs in, doing all that initial step for SIU. Then there's a certain point where they end up taking over possibly, or it could be patrol would handle that through the entire case. But it was designed for that. These guys were trained by the SIU unit to work in concert with them.
Makes sense.
A little more efficient.
Moving on to security operations, going to point out a couple accomplishments or tidbits of information. We're projecting to conduct over 1.5 million screenings into the courthouse complex and stop 17,000 prohibited items from entering the courthouse complex. Moving on to 2019, so that gives you, I guess, a little bit of an idea of what they're seeing on a day-to-day basis. Moving on to 2019, the goal is obviously to continue to keep the courthouse a safe venue for the general public, witnesses, defendants, judges, and court staff. And to accomplish this, there's a deferred personnel measure in the budget that needs further discussion. We'd like to have that take place as soon as possible, coordinate that meeting. So just wanted to point that out there. So that one was short and sweet. Now we'll move on to support services if you don't have any questions regarding security operations. Support services, the community intervention and diversion team, which we touched on last year, is now successfully running with 1 sergeant and 4 deputies. They are currently training, and the clinicians will be assigned to them in January 2019 to really start the goals of what this unit was developed for. The training academy transitioned all qualified certified deputies to the new Sig Sauer pistol. In addition, the academy ran all other required in-service training in 2 basic corrections academies throughout 2018. The therapy dog program has expanded from 1 dog to 4 dogs through private donations. The program revolves largely around victim advocacy. The Therapy Canine Unit has established partnerships and works closely with Franklin County Children's Services, Nationwide Children's Hospital, the FBI Columbus Field Office, the Franklin County Prosecutor's Office, local police agencies, drug court, veterans court, and several Franklin County and middle schools with high-risk behavioral children. The Therapy Canines work diligently with all of these partnerships and has successfully obtained disclosures from victims resulting in multiple indictments. The drone team is expanding and experiencing increased success in finding lost and missing people and suspects evading or running from deputies and other local law enforcement agencies. Moving on to 2019, our goal is to continue to expand and improve upon the CID unit with additional personnel. Expand our outreach and engagement to all communities, and in particular the Somalian and Hispanic communities, through our dedicated public information specialists. We plan to integrate the SWAT and bomb team operations for those specialized uses. Our hope and plan is to develop a plan and begin to implement a regional crime center. And finally, the training academy will run a basic peace officer training school in addition to other basic corrections academies. So that concludes support services. We entertain any questions you may have regarding those.
So you guys have a request for additional folks in the support services area, if I recall. You guys wanted some additional officers, I think, as a request from the court.
That's in the court services, not in the support. Yeah, back in the facility security.
Commissioner O'Grady, Mr. Maston referred to the deferred request regarding courtroom security. There's a total of 8 deputies. Was discussing with Deputy Administrator Long. We intend to get a meeting scheduled with all interested parties. The courts, common pleas, General Division, Domestic Relation Court, along with officials from the Sheriff's Office, our PFM facility staff, because we've invested quite a bit in cameras and those type of facility improvements that I discussed yesterday during the recommended budget message. That also plays a role in this. We need to take a comprehensive look at this so that we can look at taking action in the first quarter as far as implementing the things we need to do to improve.
Well, with the reconstruction, with the new courts, with the addition of the judges, with some of the things that have occurred, it's a good time. It's a good time to take a look at all this, and so that's good. Good. Glad we're doing it. All right.
Finally, we just want to touch briefly on the new corrections center. Phase 1 will soon be under roof. The core team has begun to work with the design team on the commissioner's design team on the continuation phase planning and design, phase 2 and beyond. We believe and are confident that this building will be a national model, allowing the Sheriff's Office and their partners to provide those under our care with programming to help break the cycle of recidivism and those attached to the criminal justice system. And finally, we would like to thank the commissioners, their staff, particularly Deputy County Administrator Long and all the other partners on this project for their tireless efforts. That concludes our presentation to highlight some of the 2018 accomplishments and 2019 goals. If there's any questions, we'd be happy to answer them, and I don't know if Sheriff Baldwin wanted to conclude with a few statements, I believe.
Great.
I really just wanted to add that since we came into office, we've accomplished quite a bit. We began by reorganizing the sheriff's office. We added command staff. We changed a lot of units. We created a support division where we combined the SWAT units, radio, community relations. We created at that time a community liaison unit with a sergeant, 4 deputies to better address the quality of life issues out throughout the community. We've now added the crisis intervention diversion unit, which is another sergeant, 4 deputies. We've added our community outreach. We've added several people there. We've added the therapy dog program. We've expanded our EOC, our Emergency Operations Center, by adding a part-time person. Transitioned all the weapons to make it safer. When I came into office, nobody carried the same weapon, the same ammunition, and for law enforcement, that can be critical, which results in safety for the community. We've added people to Memorial Hall for security. We've added a tremendous amount, and I give all the credit to the guy to my left here because we did it without asking for any additional resources. We did it all within our budget. We tried to do everything we've accomplished, we did it trying to be more financially responsible, and I think Dave's done a tremendous job on that. Just some big goals down the future. We really want to look at more cost-saving measures, possibly a transport unit to help in our staffing and better movement of inmates. Real-time crime center that Dave touched on to help out all law enforcement throughout the county. And we also are looking at a program which wasn't listed. You talked about our canine therapy, or our canines for corrections, which is more of a drug detection type. But we're also trying to talk to the animal shelter for Franklin County and partner with them and start a program in corrections of training animals for adoption, or basically to give away to people throughout the county and communities that are needy of having a companion dog. And we want to try and institute a program using our inmates to help train these dogs, and we think it's going to have a good benefit both ways.
You know,
So we're
some
pretty
of the
excited about that.
prisons do that already, and
Yes.
so I think it has proved to be very effective and a good use of time and talent that exists. And if we can train some of our folks that are in the facility to do that work, I think it'd be a terrific help.
I think it's a win all the way around. It's good for the inmates, it's good for the staff, and it's good for the residents to get the dog, and obviously good for the dog. And being a dog lover, this is right up our alley. So we're pretty excited about that, and those talks are going pretty well. They're in progress now. But I just wanted to highlight some of the things. I was kind of demanding when I came into office and put a lot of requirements on the staff, and they've really come through. They've done well.
And we thank you. And the work that you're doing makes a keen difference in the community, in public safety, and what you've done in terms of putting together the plan for the training for direct supervision and all of the other programs and projects are in line with our philosophy
Good.
of smart justice. So thank you for that. Appreciate that very much.
You're welcome. Thanks for the support.
Well, I think it goes without saying, the appreciation for the coordination, the cooperation between, the sheriff's office and the Board of County Commissioners, the level of cooperation between the staff, all of the work that's gone in, and the amount of time and effort that's gone into planning the corrections facility. That's a huge lift, a huge amount of man hours, just in terms of the time,
Yeah.
the effort to plan that facility. But the amount of time and effort that your staff, that Dave and his team put into, the budgets and the just the effort and the cooperation and the coordination and the the work that goes into, the, um, um, the back and forth and the cooperation and between your department and your staff, and our staff, it's just been fantastic. And so I commend you for all the attitude and the change and the effort that you're leading such a fantastic, team, and you're doing such a great job, and we appreciate it.
Thank you, we appreciate it.
I apologize for missing most of your presentation. I had another meeting that I couldn't get out of, but I just echo the comments of my colleagues that it's been great working with your folks. They're very professional, very responsive, and from what I can see, the relations with Franklin County in general are outstanding, and look forward to your continued innovation with this new facility. I think we've zeroed in on the cost in the facility and building and the programmatic element, but when it's all said and done, it'll be your institution to run, and I know that's where the rubber will really meet the road in terms of working together and meeting the needs of that facility. So we'll look forward to drilling down deeper as we go and being ready for that day when you shift into that new institution.
Can't wait.
We were out there a couple weeks ago. I'm not real big on taking tours of construction sites, but it's pretty impressive.
It's big.
We were out there for the topping off ceremony, and it's a big facility, but it's coming along. And I drive past it all the time, and it's amazing how quickly that thing's moving. So we're looking forward to it.
It's gonna be a challenge. It's gonna be great.
Yeah. All right. Well, thank you.
Thank you.
Thank you. All right, next up, we'll have